Come in.
Hi, I'm Josh. I'm going to be your nursing student today. I'm from the University of Detroit Nursing. And I'm just going to close the curtains real quick to provide some privacy. I'm just going to wash my hands. And we're just going to do a normal physical assessment on you today, right?
Alright.
Okay, cool. Can I see your armband, please?
Yep.
Could you say your name?
Justin Fields.
And your birthday?
May 13th, 1985.
And do you know where you are today?
I'm in the hospital.
Okay, so the patient's ANO times 3. Do you have any allergies?
No.
And are you under any pain?
No.
So the patient appears stated age. Patient has appropriate affect and appropriate responses. Patient presents no signs of illness. Patient has no serious odors coming off, and yeah, patient's well groomed and dressed to the weather. And so I'm going to start with assessing your head. So I'm going to assess for lesions and hair distribution. So there's no lesions and hair distribution seems to be normal. And then could you look at me, please? And I'm going to assess the skin of the face. So the skin's warm, no lesions, the color is normal to ethnicity. And I'm going to start by assessing your eyes. So could you look straight at me, please? Alright, and could you look at the pen? So the patient's pupils are equal, round, and reactive to light and accommodation. And could you open your mouth for me, please? And say ah. So oral mucosa is intact and it's pink and it's moist. Tongue is pink and it's moist. The teeth are intact and they're white, and gums seem to be pink. And say ah again, please. Uvula retracts and the tonsils are +1 grade. So could you smile for me, please? Frown for me. Puff your cheeks and raise your eyebrows. So the patient's cranial nerve 7 is intact, and there is no facial drooping or anything, so no signs of stroke. And could you close your eyes for me, please? And tell me where you feel this.
Left cheek. Forehead. Right cheek.
So patient's cranial nerve 5 is intact, and now I'm going to start with the neck and feel your carotid pulses. So the carotid pulse is +2. And now I'm going to also take to listen for Rui. And could you hold your breath for me, please? And you can take a breath. And could you hold your breath again for me, please? Okay, you can take a breath. So no bruise present, and the skin around the neck is also normal to ethnicity, and it's warm. It's warm and no lesions present. Now I'm going to look at your upper extremities. So can I see your arms, please? Skin is warm. Hair distribution is even. Color is normal to ethnicity. And can I see your nails? And capillary refill is less than 2 seconds. Could you go like this? No signs of clubbing. Nail beds are pink. No signs of ridging. Can I see your radial pulses, please? Radial pulse is +2, bilaterally equal, and brachial pulse also +2, bilaterally equal. And now I'm going to listen to your heart sounds, and I'm going to start with the aortic valve, which is in the second intercostal space, and then the pulmonic, which is also in the second intercostal space. The herbs is in the third intercostal space. Tricuspid is in the fourth, and mitral is in the fifth. And I'm going to keep this here for a minute to listen for the apical rate, and then I'm going to switch to the bell and go in reverse order from mitral, tricuspid, herbs, pulmonic, and aortic. So S1 and S2 sounds were heard, and it was regular rhythm, no irregular rhythms or anything. And now I'm gonna listen to your lung sounds, and I'm gonna listen in 10 different places. Could you take a deep breath for me, please? And then I'd listen for the other 10 places. 3, 4, 5, 6, 7, 8, 9, and 10. And then I'm going to listen laterally. 1, 2. And laterally over here. 1, and 2. And I'm going to listen posteriorly for 10 more places. 2, 3, 4, 5, 6, 7, 8, 9, 10. So lung sounds are clear, no adventitious sounds heard, and yeah, that should be good for that. Oh, also, could you grip your hands for me, please? So hand grips at a +5. And now I'm going to, could you lie down for me, please? So I'm gonna inspect the skin of the abdomen. So could you remove? So the skin is normal to ethnicity, no scarring, no lesions. Skin is warm, hair distribution is even. Contour is flat. Umbilicus is midline. And yeah, I'm gonna also take the 4 quadrants for lung sounds now. Sounds good. There are vowel sounds in all 4 areas, and I'm gonna percuss for tympani. So the right upper quadrant is dull, but the other quadrants I can they're tympani. And then I'm gonna percuss or palpate. So in the right lower quadrant are the right ureters and the right spermatic cords and the appendix. And then in the right upper is the liver and the gallbladder. And then the left upper is the stomach and the spleen. And then the left lower is the sigmoid colon, and then the left ureter and left spermatic cord. And could you sit up for me, please? And I'll check for jugular vein distension. There's no jugular vein distension. Now I'm gonna percuss the costovertebral angle. Do you feel any pain?
No.
For tenderness or pain, do you feel any pain?
No.
So there's no tenderness or no pain there, and the A and P diameter is 2 to 1. And could you stand up for me, please? And bend over. And the spine is the line. Could you stand up again? Could you walk over there and back for me, please? So gait seems steady and stable. And could you close your eyes for me? And then I keep them here for 30 seconds for the Romberg's test to see if there are any swaying or not. And there's no swaying, so you can open your eyes, and there's a negative Romberg test, and you can sit back down. And now I'm gonna look at your lower extremities. So I'm gonna inspect the skin first. So hair is distributed equally, color is normal to ethnicity, no lesions, no scarring. It's also warm, and then I'm gonna feel for the popliteal pulse, and that's +2, it's bilaterally equal. And then the tibial pulse, and it's +2, it's bilaterally equal. And then the dorsalis pedis pulse, which is +2, bilaterally equal. And there's no edema on the ankles. And I'm just gonna do the Babinski test. So you can just, all right, and the patient has a negative Babinski test, and I can check for the nails on the feet, capillary refill less than 2 seconds, nail beds pink. Yeah, no ridging or anything. And yeah, that concludes our physical assessment. Do you have any questions?
No, sir.
All right, thank you. And the doctor will be in with you shortly.
Great. Cool.